In this video, I will explain what kind of damages iron deficiency can cause in our bodies. Remedying these deficiencies is very important because iron deficiency is not produced by our bodies, and we need to get it from foods or supplements, which is not a quick process. When the iron level in the blood is low, red blood cell production decreases, resulting in a decrease in the amount of oxygen transported to cells, tissues, and organs. Iron deficiency leads to a condition called iron deficiency anemia. But let's discuss what causes iron deficiency. If we go through the factors that cause iron deficiency in a list form, the ranking of these factors is as follows. Insufficient iron intake. Diet. Not consuming enough iron-rich foods such as red meat, poultry, fish, legumes, dried fruits, and leafy green vegetables is one of the most important reasons for iron deficiency. Iron deficiency risk is higher, especially in individuals who follow a vegetarian or vegan diet. Absorption issues. Digestive system diseases such as celiac disease, Crohn's disease, or ulcerative colitis can hinder iron absorption. If we also touch upon some of the issues that make iron deficiency absorption difficult. 1. Phytogenic acids. Phytogenic acids found in plant-based foods, such as bulgur, oats, brown rice, can decrease iron absorption. These acids can inhibit the absorption of iron from the intestines. 2. Phosphates and phosphorus. Phosphates can reduce iron absorption, especially when consumed in high amounts. High levels of phosphate can be found in cola and other carbonated drinks. 3. Calcium. Calcium can negatively affect iron absorption. Calcium-rich foods such as dairy products can reduce iron absorption. 4. Caffeine. Caffeine found in tea, coffee, and other caffeinated beverages can decrease iron absorption. 5. Tannins. Tannins found in tea and coffee can inhibit iron absorption. These factors can affect iron absorption but do not individually increase the risk of iron deficiency. In fact, the main cause of all these factors is problems caused by unhealthy eating habits. Now let me tell you about some symptoms that indicate anemia. Pale skin, fatigue, easy tiredness, constant tension, pessimism, palpitations, shortness of breath, headache, dizziness, and blackout. Difficulty in understanding and perceiving, fever and frequent infections, bone and joint pains, disorders in hair and nails, cracks around the mouth, loss of appetite, decrease in taste sensation, desire to eat soil, lime, and chalk, restless leg syndrome. There are many reasons for iron deficiency, especially in women after entering the fertility period. Of course, we see it in men too, but when young women start to have heavy periods, when they do not eat healthily, when the lost iron is not replaced, we call this iron deficiency anemia. Physiologically, we call it iron deficiency. Now we will touch on a very important topic. Consuming gluten is a chronic cause of anemia. Moreover, when there is anemia, there will be weakness, insomnia, irritability, fatigue, lack of concentration, inability to learn. Children will have very big problems because these factors need to be eliminated for them to place information in their minds for the continuation of their lives. So if a person experiences a learning problem, the fundamental reason for this is anemia. When we increase our iron level, all problems will be automatically solved. But first, we need to eliminate the factors that cause iron deficiency. Now it may seem simple, but when you have a pain, immediately resorting to painkillers is the biggest mistake. Painkillers are also due to iron deficiency. Iron is necessary for the production of hemoglobin molecules responsible for transporting oxygen in the blood, the immune system, and mental performance. Insufficient iron intake from foods, increased iron loss from the body due to intense or irregular menstrual bleeding in women, can lead to iron deficiency. Using pain relievers due to menstrual pain can also lead to iron deficiency. Anemia can occur due to much more serious reasons. Since iron deficiency is common in diseases of the gastrointestinal system and cancers, it is important to evaluate this possibility and eliminate risks. Iron deficiency reduces the quality of life complaints directed to various organs due to insufficient oxygen reaching certain areas of the body, and anemia reduce the quality of life. When left untreated, it can lead to very serious diseases such as heart failure. However, most women today neglect this important problem caused by iron deficiency, make various excuses, and avoid going to the doctor until it affects their daily lives. Anemia can make it difficult to get pregnant. And in untreated anemia during pregnancy, the risks of premature birth and low birth weight increase. In women with anemia during pregnancy, the rate of postpartum depression increases. It can also negatively affect the mental and psychomotor development of the newborn. So, in general, you need to understand from all my explanations that if I have iron deficiency, I have caused all other diseases. You need to understand this clearly. I would like to touch on this issue. B12 vitamin is also seen at low levels in individuals with iron deficiency. The reason for this is that we should not disrupt our intestinal flora. B12 is produced in the large intestine. The most commonly used acid medications that trigger B12 deficiency stomach protectors are generally the basics I will mention. If we have deficiencies in iron, such as iron deficiency and B12 deficiency, or deficiencies in other vitamins, and if our intestinal flora is disrupted, it will not be enough to eat healthily. It will definitely be best to take it as a supplement under doctor control. Now, when everything is in order in our intestines, I will talk about a few cures and what you need to do to remedy our iron deficiency and end the video. What should be done to increase iron absorption? Beans, dried fruits, eggs, lean red meat, salmon, peas, tofu, and dark green leafy vegetables such as spinach are rich in iron. Also, foods rich in vitamin C, such as oranges, strawberries, and tomatoes, facilitate iron absorption in the body. Consuming iron together with vitamin C. Vitamin C enhances iron absorption. Therefore, consuming iron-rich foods together with vitamin C-containing foods can be beneficial. For example, orange juice or lemon juice increases iron absorption. I want to introduce you to the fruit richest in iron. Dried mulberry is the dried form of the mulberry fruit. Dried mulberry is usually collected when the mulberry fruit ripens and is obtained by drying it in the sun or in the oven. Dried mulberry is known as a nutritious fruit. It contains fiber, vitamins, such as vitamin C, minerals, and antioxidants. It is especially rich in minerals such as potassium, magnesium, and iron. Also, dried mulberry has low fat and sodium content. In terms of health, dried mulberry can support the digestive system, alleviate constipation, and improve digestive health. Additionally, due to its richness in antioxidants, it can help fight free radicals in the body. And when consumed with vitamin C, it significantly increases iron absorption rate and helps you remedy your deficiency. See you in the next video.